You just jump straight in.
Oh, okay. Okay, good morning, everybody. I hope everyone who is logging in now has got into the webinar okay. My name is Abby Changer. I'm the Careers Information and Quality Lead for the NHS Careers team. And I'm really pleased to be here for the next hour with you to give you a bit of an update on where we're at with NHS Careers and also an introduction and an overview of ways into health careers. So you're all very welcome, whether you are new to your role and sort of starting from scratch in terms of your knowledge of routes into health careers, or whether you're here for a bit of a refresher. Welcome. So I'll be talking for half an hour, 40 minutes or so, and then there'll be plenty of time for questions. I will probably pick up the questions at the end rather than doing them as we go along, if that's okay, but please do put them into the chat box and we'll get through as many of those as possible at the end of the session. If for any reason we run out of time, or if your questions are very, very specific and we're unable to pick them up today, then please do use our Health Careers Contact Centre. The contact details for that are on the bottom of pretty much every slide, so hopefully you can see it there on that first slide. So you can email advice@healthcareers.nhs.uk or call 0345 60 66 55. So that service is there all year round, so you and your students and clients can use that. Okay, so let's get going. Okay, so one of the main messages really that I'm bringing to you today is the fact that no matter what the person's role in the NHS, whether it's a very patient-facing role, hands-on, providing that care in the clinical setting, or more of a behind-the-scenes, maybe office-based or laboratory-based role, whatever that role is, those individuals are making a difference to people's lives. And that's really important, both for you to be aware of and for when you're talking to your students and clients about, you know, what they want to get out of a job, really. And I think what the NHS does offer is that feeling of having made a difference to people, as I say, no matter what the role is. And in the speech bubbles there, you can see some of the myths that we really want to bust as well. So, you know, you don't have to have a degree to work in the NHS. Yes, there are some degree level professions, but there are plenty of roles where you don't need a degree. You don't have to work in a patient-facing role. So, you know, you might really want to work in the NHS, but just think, no, I don't want to have to deal with patients. And that's fine. And there are roles there for those individuals. So those, you know, those are really important messages. Okay, so I'm going to give you a bit of background and context, and then we'll talk about some of the routes in, some of the different roles as well, a little bit about what's new, and I'll show you the resources that we've got available. And as I said, time for questions, and also the NHS Jobs website as well, which is a really, really useful resource for those of you not yet familiar with it. Okay, so the first bit of background really is the fact that the NHS is actually made up of about 1,000 different organisations in terms of the organisations that are actually delivering that care to patients and clients. And the reason I tell you that is that each of those organisations is an employer in its own right. So that means that you could have one NHS trust, for example, 5 miles up the road from you, that is offering a good number of, let's say, degree level nursing apprenticeships. You could have another NHS trust down the road the other way that isn't actually offering those apprenticeships yet, or is offering them in much smaller numbers. The training opportunities, the apprenticeships, the vacancies, those are very much down to that individual employer. And the same goes for the sort of level of school and college liaison and activity that each NHS employer will have. It can really vary, and I'm sure some of you will have found that out already, in that some will have very structured sort of work experience programs or school liaison programs set up. Others aren't quite at that point yet. So I do realise that can make it very difficult, both for you as careers advisors, but also for job seekers and for students as well, because there isn't necessarily consistency. So that's an important message just to get it just out there straight up, really. Okay, now obviously we haven't got time to talk about every single one of the 350 plus roles that there are in health. Nobody wants to be sitting around here for that long, but what we do try and do is to group the roles in health underneath these headings that you can see here, and we will briefly talk through these now, just as I say, you know, for those of you that are new to this, just to sort of give you a little bit of a flavour of the sorts of roles that are available. Okay, so first up, we've got the allied health professional group. Excuse me, this is the third largest clinical group in the NHS workforce, and this includes roles such as physiotherapist, occupational therapist, podiatrist, radiographer, paramedics actually fall into this group as well, operating department practitioners, what have I missed out? Speech and language therapists, and several others. And their roles are very much about maximising what a patient can do with the limitations they may have, whether that's due to surgery or mental health issues or other types of life-limiting diseases or neurological conditions. So about making that person able to live as full a life as they can within their specific limitations. So those roles are very much involved both in diagnosing, but also in, you know, creating treatment plans and very much supporting the patient through, whether that's, you know, short-term rehabilitation or something longer term. The ambulance service team, so really important to remember here that it's not just about the paramedics. We've got more junior roles such as emergency care assistants, patient transport services as well, and then the more behind the scenes roles, you know, not actually based in an ambulance, so for example call handlers, medical dispatchers, and those sorts of roles. And the dental team, and again, this isn't just about the dentist, you've got the dental nurses, dental technicians, hygienists, therapists, and a range of other roles as well. Doctors, so obviously this is, you know, this is one role, but with 60 plus specialties, and, you know, various ways to enhance your career once you are trained. I think one of the main messages here that the young people quite often don't understand, depending on, you know, whether they've had any exposure to people who are already doctors, but is the fact that your 5 years or whatever it is at medical school is not the end of your training. It's literally, that's the start, because then you've got your 2 years on a foundation program where you're rotating around different specialties, and then towards the end of that foundation program you choose your specialty training that you're going to do, and then if you're successful you enter that specialty training, which is for a number of years. So it really is about reminding those aspiring medics that it's not just about ticking off the medical school box, but that's, as I say, the start of the journey. Health informatics then, so this is very much a growing area within health, using that data in order to be able to improve quality of patient care. So we really, you know, we need those number crunchers, we need the people who really understand information management and technology, and you know, we're you know, slowly moving towards less paper, more digital within the NHS. So these skills are very much required, actually across many roles in the health service. Healthcare science, so I think, you know, healthcare scientists have very much come to the fore over the last year with the COVID pandemic. And again, an important message here is that some healthcare science roles are very much tucked away in a laboratory and don't have that face-to-face contact with patients, but there are others where you're very much patient-facing, diagnosing and treating. And, you know, it wouldn't be surprising if we see an increase in, for example, that real need for respiratory scientists, particularly in the, you know, in the wake of COVID and the long-term effects. We know that's leaving with us. Management, so the whole range here, whether that's from HR, financial management, estates and facilities, project management, strategy, operational, a whole range of entry levels for these roles as well. You know, from entry level kind of roles up to graduates. And there's a very, very competitive NHS graduate management training scheme, which I'll talk a little bit more about later on. The medical associate professions, this is a small group of professions. It's just 4 different professions, and the main one really for you to be aware of is the physician associate role, which is relatively new to this country. It's been used in the States for a while. You are trained in the medical model and are very much part of the medical team, so working under the supervision of doctors. And on the whole, it's a postgraduate training route, but there are now 2 universities offering an undergraduate programme. So UCLan and Reading are offering a 4-year master's undergraduate programme to train as a physician associate. So we do expect to see these roles growing. They're working in GP practices, seeing their own lists of patients. They're working in emergency departments. They're working in ward settings and other settings within hospitals. So you will see more about those. Midwifery, again, you know, we've got the midwives, we've got the maternity support workers and the other members of staff working within those teams. Nursing, so obviously this is a biggie for the health service. We know we need a lot more nurses across the 4 fields, so adult, children's, learning disability and mental health. And there are so many routes now to training to become a nurse, and we will focus a bit on that a bit later in the webinar, because we know that is, you know, often one that you are talking to students about. Pharmacy, and again, not just the pharmacists, pharmacy technicians, pharmacy assistants, and you know, what I haven't said so far is that through many of these, you've got an array of apprenticeship routes and apprenticeship opportunities in these roles, and you know, pharmacy technician is an example of one of those. Psychological professions, again, very much a growing area. You know, we all know about the mental health challenges that we face as a society, and we are seeing not only the number of different roles within psychological professions growing, but also the number of those roles, number of opportunities within those roles as well. And we will again come back to those in a bit, because there's a real range now. It's not just the graduate opportunities, but there are other opportunities as well, and a number of paid training positions as well. Public health, again, come to the forefront, I think, of people's minds over the last few months. Again, you know, a big range of opportunities here at various levels. There are a lot of graduate roles within public health, but there are also ones that are more entry level, and some apprenticeships becoming available as well within the public health area. And the wider healthcare team, which is a bit of an umbrella term for many, many roles, you know, whether that's healthcare support worker, or working in estates, domestic services, catering, supplies, so many absolutely vital roles that, you know, without which the NHS just couldn't function. So I know that's an absolute whistle-stop tour through them, but just giving you a bit of an idea of the breadth really of the roles. And, you know, as you can see, very much not just the clinical hands-on patient roles. Okay, so on to the sort of different entry points. And you can see here, you know, a real range right through from those entry-level roles, where even if somebody hasn't got their maths and English at a required level, they might still be able to access a role and be supported to achieve that maths and English, whether that's through, you know, GCSEs or gaining their functional skills. And that's a really important message. If somebody holds the right values, and we'll talk more about that in a bit, and, you know, it can demonstrate that they hold those values, then actually the necessary qualifications can be, you know, that a person can be supported to get those within the workplace. Again, this is, you know, this is down to that employer. So these opportunities may differ from employer to employer, but those options are definitely there. And then we've got the apprenticeships and training opportunities, and apprenticeships right through, you know, from level 2 apprenticeships up to master's level apprenticeships. And the number of apprenticeships is increasing all the time, with new ones being added. After a course at FE College, so for example, somebody might be doing a BTEC in health and social care, which would be a great stepping stone on to, you know, nursing, for example, or midwifery, or many of the other roles. Or we know we've got the T levels coming in as well, and that will be, again, another good route into health. After an approved higher education course, such as a DIP-HE as well, you know, some roles, that's the perfect stepping stone on. And after a degree, that, that is a very common one within health. So for example, if you want to be a physiotherapist or a speech and language therapist or a podiatrist or a prosthetist, you are going to need a degree. Now, there are the degree level apprenticeships now, but at the end of the day, those are degree level professions in, however you've gone about getting your degree. Postgraduate training. So there are some roles in the NHS that do require postgraduate training. So for example, to be a clinical psychologist, you need postgraduate as a doctorate level qualification, and to be a clinical scientist as well, you do need postgraduate training. So, there are those roles where you do need a very full sort of academic portfolio, if you like. Or after experience gained outside the NHS. So that's, that's important for people to know as well. And I think particularly this year, where we're seeing so many people sadly losing their jobs in other sectors, if they hold, a right sort of experience, the right values, then there are going to be roles in the NHS that they can access. And we very much welcome that breadth of experience, if you like, and different learning from other sectors. Okay, this is just to give you a little bit of an idea of just a few of the apprenticeship vacancies that there have been in the NHS over about the last 3 months. Now, please bear in mind that this is just a sample, and what I've tried to do is pick out a range of different level apprenticeships, but also different types of apprenticeships, as in some clinical, some non-clinical. So I won't read them all now, but you can see there things like, mechanical electrical apprentice, apprentice operating department practitioner, so that's a degree level apprenticeship there, as is the healthcare science apprenticeship in cardiac physiology, apprentice pharmacy technician, nursing associate apprenticeship. We'll talk a bit more about nursing associates later. And at top right there, you can see a registered nurse apprenticeship, so that's a degree level apprenticeship in Surrey there, leading to fully registered qualified nurse. And finance apprenticeship. So yeah, as I said, just a little bit of a taste. Another couple that I've seen literally in the last week are a customer service practitioner apprenticeship, which is a level 2 apprenticeship, and they're asking for maths and English GCSEs at a 3 or above. Supply chain warehouse operative, they're asking for 3 GCSEs, including maths and English. The person doesn't need any experience. So there are real opportunities there for school leavers as well, and that's important, really important message. Okay, so the degree level apprenticeships. A bit of a taste here of some of the ones. These are largely from the allied health professional group, but there are some others, as you can see. So we've got diagnostic radiographer, dietitian, healthcare science practitioner. So this apprenticeship incorporates the PTP, the practitioner training program, which is what you also find in the healthcare science degrees that some universities offer. So that means that the degree incorporates a set period of time working in the NHS on placement, and means that the successful graduates from that can apply for practitioner level healthcare science roles. And that's what this degree level apprenticeship provides as well. Nursing associate, so this is a foundation degree, so this is at level 5. The nursing associate is a relatively new role that sits between healthcare support worker and fully qualified nurse, and is very much either a stepping stone onto nursing or a job absolutely in its own right that some people, will absolutely flourish in and want to continue in. And you can see the other degrees, apprenticeships available there. The HASO website that's in the box underneath the pictures there in the middle of the slide. This is a really useful website. This is the website where you can find out information on the latest healthcare apprenticeships. So if there's one in particular you're keeping an eye on, you can find out where it's up to in terms of the approval process. The word of warning I will give here is that just because an apprenticeship has been approved doesn't mean to say that there are going to be vacancies yet. And we've seen that, for example, with midwifery. So the degree level apprenticeship was approved probably getting on for a year ago now. We didn't actually see any external vacancies until about a month ago. So the first cohort of midwifery degree level apprentices started back in January or February time, but they were all existing maternity support workers within an NHS trust. But I did see the first external advert. I think it was in Maidstone and Tunbridge Wells, actually, that trust down there in Kent. They advertised an external advert, as I say, within the last month. And we do expect to start to see this number picking up. But it's just to be aware that just because an apprenticeship has been approved, that doesn't equate to lots and lots of vacancies at this point in time. Okay, apologies for the rather small font on this size. So full-time undergraduate opportunities within clinical. So you can see a range of degrees available here. The ones that are in bold are the ones that are courses covered by the NHS Learning Support Fund, so eligible students, and by eligible, what that means is that they need to be eligible for student finance as well from Student Finance England, so those are largely around sort of residency criteria. Eligible students can access this NHS Learning Support Fund, and for those courses in bold there, they will receive £5,000 a year in a training grant, plus some additional funding for certain ones of those courses, and we'll talk a little bit more about that in a minute. Dentistry and medicine, there's financial support for the final year of the 5-year degree. The ones that aren't in bold there's no NHS support available for those particular courses. Okay, so just to run through some of the graduate opportunities within the sort of clinical roles. So the scientist training program, this is a really popular program. It's a master's level 3-year paid training program. And it's a really common progression route for people wanting to become clinical scientist. So this is known as the STP, the National School for Healthcare Science, manage all the recruitment. It's an annual recruitment cycle. It's due to open this year. It's due to open in January. And this year there were 350 plus places. Depending on the specialism, and I've just seen a typo on my slide there, apologies for that, it shouldn't be rations, it's of course ratios. Competition ratios varied from 4.9 applications per place to 77 applications per place, depending on the specialism. The 77 I think was blood transfusion, and the 4.9 interestingly was critical care science, which actually I'd have thought would be quite popular, but obviously not. So that is for people with a relevant first degree, which needs to be a 2-1, or if they've got a relevant higher level degree. So if you're interested in that, have a look at the National School for Healthcare Science, because that's where you'll find all the information about it. Biomedical scientists as well, so there are a few trainee posts still, but we are seeing this practitioner training program being a major route to becoming biomedical scientists now. So whether that's via the healthcare science degrees at university or the healthcare science degree level apprenticeships. Physician associate, so I mentioned that earlier, so as I said, on the whole postgraduate training, but there are now the 2 undergraduate courses. Arts therapists. So you do need postgraduate training to become either a music, drama or art therapist. And the psychologists, as I mentioned earlier. So to become a psychologist, you need postgraduate training, but for many of these other roles within the psychological professions, they are often open for graduates, but some of them will accept people if they've got the relevant experience, even if they don't have a degree. So there's quite a mixed bag there. We do also have some accelerated programs for graduates. So that list that you can see there, the ones, so dietetics, nursing, occupational therapy, physio, radiography and speech and language therapy, graduates who choose then to do the accelerated programs will still be eligible for the NHS Learning Support Fund, providing they meet the other eligibility criteria I mentioned earlier. So, and also usually are able to get a second round of student finance. These programs, so for example, most accelerated nursing programs are 2 years long. Some universities are more flexible than others in terms of what the first degree needs to be in. And it's by no means a given that just because you've got a first degree, you are going to be able to access one of the accelerated programs. It's very much down to that university to work with the aspiring student to map what they've already learned and to see whether it is suitable for the shortened course. Okay, non-clinical graduate opportunities then. So the NHS Graduate Management Training Scheme, which I mentioned earlier, which requires a 2-2 in any degree discipline, and it doesn't matter how long ago someone got that degree either. That is open, applications are open right now for 2021 starts. Just to give you an idea, you can see there in that sort of speech bubble thing on the stats. So for 2019, there were 9,000 applications for 262 starts. This year has been a little bit messed up because of COVID. So there were 11,000 applications for people wanting to start in September of this year, but that start has actually been delayed. So they've selected 250 to start in March next year, and then there'll be another cohort starting in September, which will be a combination of people who applied this year and those who are applying right now. And there are those 6 streams that you can see there, and they also gain a professional qualification during that paid for training scheme. Okay, so other non-clinical graduate opportunities, there's something called the Graduates into Health scheme, which has got a bit more of a focus on IMT, project management, HR. Again, a 2-year programme, paid, salaried, and there are usually 3 intakes a year. And there's also a specific graduate surveyor training programme and opportunities within NHS Digital, very much as you can imagine, focused around that, the data science, software development, and user-centered design around websites, etc. And then often NHS Trust will run their own graduate schemes as well. So that's where you'd keep an eye on NHS Jobs for opportunities. So there's lots out there. Okay, so I've touched on this a bit already. So financial support for healthcare students. So the NHS Learning Support Fund, thank goodness, was expanded from this year. As some of you who've been around for a while will know, there used to be an NHS bursary for many of these courses, but the government removed that in 2017. But shortly after election last year, they did announce that the introduction of this training grant. So eligible students studying that list of courses that were in bold will hopefully be eligible for this £5,000 a year. And then the other elements of the fund are £2,000 a year parental support if people have got dependents, £1,000 a year on top for specialist subject payments. So where we've got particular shortages, so mental health nursing, learning disability nursing, radiography, podiatry, prosthetics and orthoptics, that qualifies for the specialist subject payment. There is also going to be at some point a £1,000 regional incentive. We still haven't heard which regions of the country will be benefiting from that. So I'm afraid I can't give you any more information on that at this time. And then there's an exceptional support fund and help towards travel costs if students are having to travel to clinical placements. And as I mentioned, student finance as well. So even if people are studying their second degree, and meet other eligibility criteria, then they are able to access student finance. Okay, so a little bit on trends, changes and new roles, and I am how are we doing for time? Just before past. Okay, so the NHS terms and conditions, the majority of staff in the NHS are on what's called the Agenda for Change pay system, and there are 9 pay bands. And these range from pay scales of, as you can see there, about 17,500 a year up to just over £100,000 a year. To give you an example, a newly qualified nurse or a newly qualified occupational therapist or radiographer would start on £24,907 a year outside London. If they work in London, then there are cost of living allowances that do bump that up quite considerably. Now, the nursing associate role, I did mention this briefly earlier. As I said, so a role that sits between healthcare support worker and fully registered qualified nurse. It was piloted a couple of years ago now, and the route to training as a nursing associate is via a level 5 apprenticeship. And we're seeing quite a lot of adverts for these at the minute. The problem is that we're seeing quite a variation in terms of what the employers are looking for. So some employers are asking for example, 5 GCSEs with maths and English at a 4 and above. And that's pretty much it. Other employers are asking for a level 3 qualification and, for example, 6 months or a year's healthcare experience. So there really is quite a variation. So with some employers, it very much is an opportunity, potentially a post-GCSE opportunity for students. For other employers, they're making the bar a bit higher. But if you've got students who are very much interested in nursing, but perhaps not quite sure how they're going to get there, not sure they want to go to university, not sure they're going to be able to access university or a degree level qualification, this could be a great route for them. We'll give them that level 5 qualification and the option then of potentially going on and doing a shortened nurse degree apprenticeship, or, as I say, staying as a nursing associate. It is regulated by the Nursing and Midwifery Council as of January last year. And as I say, you know, they're quite often advertised as trainee nursing associates. So keep an eye on NHS jobs if you've got students you know would be potentially interested in that role. Graduate Management Training Scheme we've mentioned, so the numbers do seem to go up pretty much year on year, and they are expanding again for the 2021 intake, although as I said, it's a little bit different this time around because of COVID. Medicine, as many of you will probably know, we've seen an expansion of medical schools places over the last 2 or 3 years or so, and the new roles in the psychological professions, so roles such as education mental health practitioner, which is a 1-year training post, postgraduate diploma level, and children's wellbeing practitioner, again 1-year training post. Peer support worker, this is a relatively new role which we do expect to see growing, and we are expecting an apprenticeship route as well at some point in the not too distant future. These roles are for people with, it doesn't matter very much at all about qualifications, but these are for people who have got lived experience of particularly mental health challenges themselves. And those roles are very much there designed to help support patients and clients through their journey. Clinical associate psychologist, this is a very, very new role. I've seen the first few adverts coming out over the last few weeks. It's a level 7 apprenticeship, and this role is designed to sit between assistant psychologist and clinical psychologist. So it's a very exciting role. It's for psychology graduates, and again, we expect to see this role really expanding. Physician associates, we've mentioned already. I've also talked about the nursing shortage. So the current government wants 50,000 new nurses in place in the next few years. One of the things that we have seen in the last, well, which is very new, starting next month, in fact, is the introduction of what are called blended learning nursing degrees. And these are where the majority of the academic component of the course will be delivered online, virtually. And these are very much around making it more flexible for people who particularly may have home commitments, so maybe caring commitments, for example, and would find it difficult to get onto a university campus, you know, on a daily basis. There obviously is still a requirement for people to do clinical placements, so that they will need to commit to those. But it really does make this route much more open and more accessible for people who might just not have been able to access university otherwise due to home circumstances. So there are 7 universities starting those between January and April 2021. Financial support we've mentioned, and then just a little bit there about the sort of the fact that digital skills are just required in more and more roles within health. So, you know, there was a big review called the Topol Review published last year. So in 20 years, 90% of all jobs in the NHS will require some element of digital skills. And as you can see there, that's, you know, telemedicine, smartphone apps, genomics, robotics, and artificial intelligence technologies. As you know, as you can imagine, those things are all becoming increasingly important. Okay, I just want to very quickly run through some examples of routes into nursing in England, and this is just to illustrate how the end point, so becoming a fully registered qualified nurse with the Nursing and Midwifery Council, that end point can be reached via a variety of routes. Now, I'm very aware I'm running out of time here, so we will quickly just talk through these. So right from sort of the 5 GCSEs, including maths and English, to being able to access the 2-year nursing associate apprenticeship, and then a shortened nursing degree level apprenticeship. So it's usually a 2-year top up for a nursing associate. We're seeing that becoming more common now. Then the more maybe traditional route, if you like, so 3 A levels, going off to university, doing your nursing degree at university, becoming a nurse. Someone with a first degree in psychology, interested in mental health nursing, is able to access an accelerated, shortened nursing programme and complete that in 2 years. Somebody working as a healthcare assistant is able to access a level 3 senior healthcare support worker apprenticeship, and then if the opportunity is there, access the degree level nursing apprenticeship. Then we've got someone completing an access course to access to HE course in nursing and going on to access a nursing degree that way. Somebody with a BTEC able to access a nursing degree. Somebody, again, another example here of a degree in biology, able to get a Pell and complete the shortened children's nursing degree. And then this one here, so someone who hasn't got maths and English at 4 to 9, but is able to get a post as a healthcare support worker in the local NHS trust, gets onto the level 2 healthcare support worker apprenticeship, and then level 3 senior healthcare support worker apprenticeship, and that then gives her what she needs to access a degree level nursing apprenticeship. So I hope that gives you an idea of the flexibility. And there are various things going on in different areas of the country, supported internships and traineeships available in some NHS organisations. As I said, these entry-level jobs and apprenticeships, and the option often to be supported to achieve that level 2 functional skills. There are some cadet programmes in place as well. And as you probably know, contextual offers often available from universities depending on the young person's background. And Prince's Trust programmes as well. There's a big contract at the minute within health and Prince's Trust, so you'll probably see a lot more opportunities coming through in your local area. Okay, so on to resources for health careers before I shut up and answer some of your questions. So we have got a range of postcards with sort of myth-busting inspirational messages on them. And then we do have this little A6 booklet here, which goes through around 60 plus of the roles in health and is just a handy kind of pocket-sized guide. So you're able to order these free of charge by getting in touch with our contact centre. Some of you may already be familiar with these. We realise that, you know, face-to-face events haven't really been happening over the last few months, but those resources are there for you if you'd like to get hold of some. Values-based recruitment. This is really, really important because somebody could have all the qualifications, tick all those boxes for a particular role, but if they don't hold the right values, then they're not going to have that right fit with the NHS. So the NHS and also those recruiting for healthcare courses are very much doing values-based recruitment now. These 6 values are from the NHS Constitution, and what someone needs to do in their application and an interview is be ready to evidence how they demonstrate those values. So that experience can be drawn from any area of someone's life, whether that's from their home life, their school or college life, a Saturday job, volunteering, work experience. It doesn't matter where that experience has come from. It's about their ability to relate that experience to evidence that they hold these values. Or they might be asked, you know, tell me about a time when you've shown respect and dignity. Or how would compassion be displayed in this job that you're applying for. So these are absolutely key. And often NHS organisations such as an NHS Trust will have their own set of values as well, very much based around the NHS Constitution. But if you've got someone applying for a job at a particular NHS Trust, they need to be looking at what those trusts' values are as well, and making sure they're ready to talk about those. Really, really important. The Health Careers website, some of you might be quite familiar with this already. There is a lot of information on here. I can't possibly tell you about all of this, but go away and have a look if you're not already familiar with it. There's the top menu there. The Explore Roles section will be particularly helpful to you and your students. It has got a page of information on over 250 of the roles within health. You know, sort of day in the life of, entry requirements, training and progression opportunities, that sort of thing. The career finder quiz as well is very popular, and you can encourage your students to register, and yourselves actually, to register for an account with Health Careers, and then you'll receive targeted information based around the registration information that you complete. At the bottom of the page, you can see there's some teacher and career advisor resources. In the middle there, that little picture of sort of the three people that looks like they're holding hands, that's where you'll find the values information. And there are a range of videos as well, which can be a really helpful way of bringing your role to life, and people talking about how they find their role. Under the Explore Roles section, you can also compare up to 3 roles side by side, which can be a useful way to sort of help make decisions. There's an events calendar as well. Lots of information. So do have a look. There's the compare roles feature. So just as if you're picking a toaster from Currys or something and want to compare the different features, you can do the same with the jobs here. The Find Your Health Career tool, this, as I said, is really popular. So it's a series of statements, and depending on how they're responded to, it then brings up some options that match that person's skills and interests. So a really useful tool potentially for your students if they know they want to work in health, but don't really know where to start and what to look at first. The course finder tool as well, this is really helpful. So we list courses on our website that lead to professional registration. So if somebody is looking, for example, for a nursing degree, a learning disability nursing degree, then they can use the relevant filters on the course finder, and it will bring up a list of the courses, and there are links through to the university webpage. As you will know, universities do vary in terms of the entry requirements, so I can't emphasize enough the need for students to look at the entry requirements from particular universities, because, as you know, some are more flexible than others, but that's a really useful tool. The Step Into the NHS website, so this is aimed at Key Stage 3 and 4. It's had a bit of a refresh over the last few months, and this is where you'll find the information, as well as information on some of the roles and a shortened career finder quiz. You will also find all the information about the schools competitions that we run every year. Hopefully some of you are already involved in that, but we've got 2 schools competitions, one aimed at primary, one at secondary. So do have a look and find out more about those competitions. And other resources there, so there's some for Key Stage 4, there's a work experience guide, there's a termly e-newsletter for careers professionals, so if you're interested in that, please do sign up through our website. And as I said, the Key Stage 2 and 3 resources and competition details. So do have a good old dig through what's on there. Okay, so just a few FAQs which might cover some of the things that we've talked, you might have questions about. So yes, there are loads of apprenticeships now at a variety of levels, and hopefully you saw from that slide I put up with a small selection, then you know there really is a massive range. Work experience, we know that's is particularly tricky at the moment. It's never easy, but it's particularly tricky at the moment. Really encourage your students to think about that values bit that I just mentioned, and to think about their experience and how they can relate it. If they've worked in a shop, you know, if they've worked in the local shop on a Saturday morning, that's customer service skills. they're still going to be demonstrating some of those values from the NHS Constitution and able to talk about those. So it doesn't have to be health related work experience necessarily. And employers and universities are being they do know what it's like at the minute. So, if people are wanting to apply to university and are particularly worried about whether they've got the right work experience, encourage them to get in touch with that university and have a conversation, because, as I say, on the whole, people are being more flexible. There are more alternative online opportunities coming up now as well, so do search online to see if you can find anything virtual that may help. And it's about, I think, just gathering whatever you can at the minute as a student that can help, as I say, evidence that you're the right sort of person for the course or the job. If you want someone to talk to students, attend careers events, please get in touch with your local NHS organisation, but also use organisations such as Inspiring the Future, Young Apprentice Network, the STEM Network, etc. And my predecessor, Alan Simmons, wrote a piece on the National Career Week website, the link is there, which talks about how health careers and the resources can help you achieve Gatsby benchmarks. So if you're interested, do have a read of that. Okay, we're nearly there, folks. So the NHS website, I just wanted to highlight this because it is such a useful resource. So this is where all vacancies in the NHS in England and Wales are advertised. It is where all NHS apprenticeships will be advertised as well. In theory, they should also be on the Government Find Apprenticeships website, but I also always recommend looking at both, just in case any slip through the net. There's a simple search facility, so just use 1 or 2 keywords. Be prepared to search for jobs in different ways using different keywords. And if you've got a student particularly looking, say, for a healthcare support worker apprenticeship, get them to register with NHS Jobs, and they can then set up an email alert, and they'll receive an email when a job matching their search is advertised. So it's a really good way of keeping on top of those adverts. But also useful for you in terms of keeping an eye on what are employers looking for. Click into that person's specification, see what they're looking for, see how many adverts there are out there to get an idea of, of how many are being advertised. If you're wanting to get in touch with your local NHS employer on NHS Jobs, if you go to Browse Jobs, there's a really helpful map here and you can find the contact details for local NHS organisations. There's the website links and some other signposts. Thank you so much for listening. I'm aware it's a lot of information to get through, but I'm going to stop sharing my screen now and we will go to the questions. Okay, so let me just get the chat up so I can see it. Great, so a good few questions. So we'll try and get through as many as we can. We've got just under 50 minutes. Okay, so bear with me while I just read through these before I answer. So, rarely seeing entry-level roles such as healthcare assistants being advertised as apprenticeships within Greater Manchester. Should I still be encouraging students to apply for these roles? Even if they don't include the word apprenticeship, will there still be appropriate training and progression opportunities in this role? I would say there are likely to be. Obviously, I can't definitively say there'll be training and progression opportunities, but I would be surprised if there weren't. And I think I'd encourage either yourself or get one of the students interested to get in touch. So if they see a healthcare support worker role, which could be called a number of things as well, we don't make life very easy, so it could be called a healthcare assistant, it could be called a clinical support worker. There should be a named contact, either a phone number or an email address with any NHS vacancy. Give them a call or email them or get your students to do that and to find out more, because that's how you find out that sort of, okay, so ideally I want to get onto an apprenticeship. If I apply for this, will there be opportunities to access an apprenticeship or training? Quite often there will be. I know in my local trust, if you get a job as a healthcare support worker, you're automatically enrolled on usually a level 2 qualification and then have an opportunity to progress on to level 3 and upwards. So keep looking, but get in touch with those employers and find out exactly what the offer is. Okay, is there a site where it lists the graduate opportunities and any prerequisite qualifications, e.g. psychology, that university students can go to? Okay, so we do have a page of information on the Health Careers website for graduates. Let me see if I can share my screen and I can show you where that is. Okay, so hopefully you can all now see could someone just let me know in the chat whether they can see the Health Careers website now? Thank you. Okay, so this is the Health Careers website live. So under career planning, we have got and then study and training, there's a graduate training opportunities page, which goes through various of the graduate programs, and also things such as the scientist training program I mentioned, specialty training in public health, and other opportunities. So that's where you can look for graduate opportunities. Okay, right. Will these slides and recording be made available to refer back to? I believe so, but Ashley will be able to confirm that for us. Right, are IAPT trainee roles offered on a fixed term contract for the period of the training course? Yes, they are. So for those of you that don't know, IAPT is improving access to psychological therapies, and this was introduced a few years ago. It's a way of, as well, does what it says on the tin, hopefully making mental health support more widely available. And there are two main roles: psychological wellbeing practitioner and high intensity therapist. And yes, so those are fixed term contracts. Right, where are apprenticeships? Not many advertised. Okay, I do see quite a lot advertised. So I'm registered with NHS Jobs, and one of my saved searches literally is the word apprenticeships, and I get several through each day. So keep looking. If there aren't many in your particular area, this comes back to what I've said about it not necessarily being an even spread across the country, unfortunately. Get in touch with your local NHS trust, see what their plans are. It might be that they're about to advertise a load of apprenticeships. So do keep looking is what I would say to that. They will come. Right, can graduates access some of these apprenticeships as well as school leavers? Yes, so the thing with apprenticeships, as you probably know, is that it has to be what's called significant new learning. So it can't be something that someone's already covered from a previous course. They can't then access an apprenticeship if they're going to be going over a lot of the same ground. But yes, so there are some of these level 7 apprenticeships. And yeah, it would be very much down to the individual employer to decide whether that person was suitable for the role or not. But it's certainly possible. Specific name for so this little book here, so it's called 350 Careers, One NHS, Your Future, but you will find it on the Health Careers website. But yes, if you're calling the helpline or emailing about it, then if you ask them, we do only have one booklet now. Actually, we used to have a larger range, but we've cut down to this one booklet. So yeah, 350 Careers, One NHS, Your Future. IAPT trainee roles, are they advertised around the starting of the adjacent university course or any time of the year? Are these funded if started without being within an NHS role vacancy? No, so these roles aren't part of the deal, is that you are on a training position and they're funded that way. And yes, so we do see sort of little clusters of the adverts depending on when the courses are starting at university. So I would suggest, if you want to find out in your local area, if you know which university runs these courses, then get in touch and find out what their roles will be, what their start dates will be, and then work back obviously a little while, because employers will be advertising previously to that. Hope that makes sense. Okay, do graduate roles such as psychotherapist, psychology, wellbeing roles require a first degree in psychology, or can they have any first degree? Okay, so this, for psychotherapist, it's a little bit of a longer training route. Actually, a really good website that I recommend, that I'll put in the chat. It's got a great career map for the psychological professions, is the Psychological Professions Network, and they've got a great career map there for people who are wanting to go into the psychological professions. For a psychological wellbeing practitioner, there are actually, there's a couple of ways of getting into it, because for some, you can apply with a degree, but you can also apply if you've got experience. So you don't have to have a degree to access a psychological wellbeing practitioner role. If you've got the right experience and you hold the right values, then actually the training route is available to you. But a typical route would be a psychology graduate, as for many of the psychological roles, but there are other ways around. And the psychological professions and actually healthcare science do a lot of what's called equivalence route as well. So if people can build a portfolio evidencing that they've got the right experience in the right amount, and also that they have the academic ability, even though they might not have actually achieved a degree or a master's, for example, if they can demonstrate through a portfolio that they've achieved the equivalent level of academic knowledge and experience, then these roles are open and these progression routes are open. Right, opportunities for older people 50 plus who may be looking for career change, maybe after redundancy. So this obviously is really coming to the fore at the moment. We've seen a real increase in queries to the Health Careers Contact Centre from people like this. There are all sorts of opportunities. Obviously depending on someone's previous experience, but again, I would encourage them to set up a job alert on NHS Jobs, see what's being advertised locally to them, and look at that person's specification, see what's on there. Even if people don't quite meet the person spec, get in touch with that named contact on the advert and see what they, have a chat to them, because it might be that after a conversation with this person that they realise that they'd be exactly right for the job. So a whole range of opportunities here, from clinical to non-clinical roles. There's a big We Are the NHS campaign out at the minute. You've probably seen it on telly. Healthcare support worker roles, but all sorts of wider healthcare roles. I'd encourage them to do the Find Your Career quiz actually on the website and see what they can see what comes up there. Okay. Right, which careers attract secondary funding? Is it all medicine and allied health professions minus paramedical science? So not for medicine, but for nursing, midwifery, and the majority of the allied health professions, they will attract second degree funding. You're quite right, paramedicine is a weird outlier. I don't know why this has happened, but if you're doing paramedicine as a second degree, you can't get a second lot of student finance. But if you meet the eligibility criteria, you can get the NHS Learning Support Fund, so that £5,000 a year training grant I mentioned. I am aware that there are conversations going on at the Department of Health and Social Care about bringing paramedicine in line with the other courses that I mentioned, but at the moment, weirdly, it's not. Okay, I'm very aware about time. Email for the careers booklet. So that is our careers contact centre. So advice@healthcareers.nhs.uk, and also by calling their number, which I can never remember off the top of my head, 0345 60 60 655. And a few thank yous. Good. I'm glad it's been helpful. I'm very aware it's an absolute rattle through. There is so much to get through, but please do use our Health Careers Contact Centre. Please, both for you and for your students as well. And I think the message is that, there are so many different routes now, and it's about seeing what's available to you locally if people are sort of stuck locally. But there is pretty much always a way to get to an end point, even if it takes a little bit longer. Thank you for listening, and have a good rest of Monday.